Hi, how are you? Hope you are doing well. For today's videos, I'll talk about the job responsibility and job duties of a hospital patient transporter. What you expect to do during your work hour. So here's a quick overview. So pretty much you transport patient most of the time in the hospital from point A to point B. That's what you spend most of the time doing in the hospital. So as of previous videos I've mentioned and put out on my channel, I have covered what is a hospital patient transporter, how to become a hospital patient transporter, and what are the pay rate. Pretty much tell you how much you get paid per hour and a year. So you should check them out later when you have time on my channel. For this video, I will talk about the details specific of what you expect to do in a hospital. Transporting patient on a gurney or wheelchair is your number one priority as a transporter in the hospital. That's what you mostly be doing inside the hospital. So you pretty much you could transport patient from ER to the ICU or ER to the hospital floor. So you go from ER to the measures, go to the burn unit, or sometimes if it's children or a kid, you go them to, let's say, pediatric floor, or let's say it's a baby, you send them to NICU on the L&D, labor and delivery. Or sometimes you could also take the mom from the waiting room to the L&D, or from the L&D take them down to the floor to, let's say, radiology for ultrasound. Sometimes you could even take help the nurse from L&D, transport patient from the surgery to the recovery room. So there's a lot of transportation of patient. Most time you will go with a nurse or CNA, but sometimes you transport patient by yourself. So that's your main job as a transporter in the hospital. Locating and delivering hospital equipment. So pretty much, let's say that a department need a bed or wheelchair. So for discharge or for patient intake, they will call the transporter dispatcher, and dispatcher will tell you, hey, let's say med-surg need a bed for a patient intake from an ER or ICU. So you have to go find a bed. Most time the bed is right in a maintenance room or engineer room. So you have to, most time your dispatcher will call the engineer or maintenance. They will tell, oh, there's a bed here. You go find that bed. You bring that bed to the floor. Or sometimes the nurse or the CNA from the floor or ER will say, hey, we'll call the dispatcher and say, hey, we need a wheelchair. I need to take this patient to this place. I need to take this patient for discharge. I need a wheelchair. Now they will call you and say, hey, this floor, ER, ICU needs a wheelchair. Can you take a wheelchair from the lobby or from find a wheelchair, bring it to the department? Most time for hospital equipment, it's usually the bed, wheelchair, oxygen tank. Sometimes you need to find an IV pump. That's rare, but it does happen. Or you could go, if your hospital have L&D or maternity ward, they will ask you, like, hey, can you find me a NICU bed? Or can you find me a baby crib? Or some type of baby equipment for the babies. So it depends on situation, but most time it's very standard procedure where you find this. Pretty much you transport from point A to point B. So if it's too big for you to move, let's say a big ICU bed, then you can say, hey, I need another person to help me. You're a dispatcher. As a dispatcher, I worked before, I will send you another person. I say, okay, I will send you, just wait, let me find someone that's free, I will send it to you. So for documentation and record, anytime you work in the hospital, there's always going to be a record of patient transport or any type of procedure. So let's say that you get a call from your dispatcher and say, hey, I need you to take this patient from point A to point B. For example, let's say you need to take a patient from ER to med-surg, right? So most time the nurse from ER will go with you to transport up to the floor. But let's say you take that patient up to the floor, let's say med-surg, and then that patient needs to go down to radiology. Let's say that patient needs to go down to get an x-ray. So you will get your run sheet. Your run sheet is very small. It's like small paper. The run sheet will have the patient name, the floor number, the room number, medical record. In some cases, depending on hospital, there will be also date of birth and the nurse that you pick up the patient from. So let's say the nurse for med-surg is, let's say name is Lisa, right? So you go to nurse Lisa and say, hey, I'm here to take this patient going down to X-ray. You get the nurse signature, say, okay, for patient transport care, okay, this patient going down to X-ray, gets that signature. So now the patient is in your care. And you go to a patient and say, hi, my name is John, I'm taking you down to X-ray. And then verify the information, like this is your name, your date of birth, your medical record. All the patient in the hospital will have a name tag, not name tag, but ID bracelets. So check that. After you get a patient on your gurney or wheelchair, you take a patient down to X-ray, you will transfer care. So usually you will get a tech. If there's a nurse there, X-ray don't have a nurse unless you go to ICU or ER, there will be a nurse. But for let's say you go to X-ray, you get a tech signature. So they say, okay, now transfer care. Can you sign this? So the tech will sign it and say, okay, now I'm done with that call because the transfer care has happened. You get the patient to X-ray, the care is transferred from you as a transporter to the X-ray tech. So assist and provide support for the hospital during emergency or crisis. So this is very kind of complicated, but most time the best way to go about it is your house soup will call your dispatcher. Your dispatcher will tell you what the situation is going to be. So let's say most hospital, when you have a divergent or cold black, depending on hospital, that means your ER is fully packed. Your hospital is kind of at the capacity for like workload. There will be a lot of patient moving around to make room for more patient coming in. At this point of time, it's usually your dispatcher, your house soup, and your charge nurse up to all the floor and ER and ICU will work together and figure out where the patient is going to be moving around. So as a dispatcher, that's my job, talking to the nurse, talking to the house soup to figure out where the situation will be. You, as a patient transporter, all you need to do is listen to the dispatcher. They say, hey, this patient will go to here, and then take care of that, and I will kind of delegate your task. So don't worry too much about the divergent or cold black situation. Now, there's a time when you have a hospital lockdown. I have been in 3 lockdowns before. I think 2 of them for like a bomb. Well, 1 of them is for bomb threat, and 2 of them is for gun. Well, initially we thought there's someone in the hospital with a gun, but it's kind of false. One of them, they actually it's on TV too. Like, police had to come in and kind of check the whole hospital, lock down the hospital, but again, we didn't find anything. But when that situation happened, hospital still run normally, but again, dispatcher, house soup, and charge nurses will figure this stuff out. As a patient transporter, you just go, pretty much you go like how you do in your normal situation, transport patient. Unless something come up, your dispatcher will tell you what the situation will be and whether or not you continue to transport patient. HIPPA and work in a safe manner. I think this is very obvious. When you work in hospital, you have to protect the patient privacy. So what that means, let's say if you know someone, or let's say someone famous come in, let's say Tom Cruise is in the hospital. You're not gonna be like, oh my God, Tom Cruise is here, and you blast out all over social media. You're not supposed to do that. So therefore, anytime patient name, patient record, anything that involves patient, don't tell anyone. Don't put it on social media or don't tell your friend. That's pretty much it. Like, just don't be stupid. And for safe working condition, when you transport patient, make sure you don't hurt the patient, especially when with gurney. So when you move a patient from a bed to a gurney, if the patient too heavy, ask for help. Please ask for help. As a dispatcher, if my transport say, hey, John, this patient is too heavy, the nurse don't want to help, I say, okay, just give me a minute. Either I will come to help you, or I will send someone to help you. Don't break your back. As a patient transporter, don't get injured on a job. If it's too much for you, wait for help. You could always ask for someone for help. If they refuse to help you, talk to your dispatcher. Talk to me. I will talk to the nurse. I will talk to the house soup, because it's a team effort. They're not supposed to be leaving you there as a transporter to do everything by yourself. If it's too heavy, you ask for help. If not, then there was someone there in the hospital to help you. Professionalism and team player. This one is kind of difficult because Again, let's talk about team player first. As I previously mentioned, it's a team effort in the hospital. You are expected to work with everyone. Some nurses will be kind of difficult, but again, like, everyone is a hospital. Sometimes they get stressed out, so be understanding, work together. Remember, it's for the patient, healthcare. So you want to put the patient first, take care of them. And remember, patients are there, they're in pain, they might die. So you have to be understanding that sometimes they will be mean. I have patients that curse out at me. I have patients that say racist things to me. I have patients that spit, kick, assault me. And again, you just take a step back and say, okay, like, I'm here to help you. Explain the situation, say, hey, I'm just here to help you. I'm here to take you to x-ray. I'm taking you to radiology. I'm taking you to the floor. Try to have a communication with them. Let's say it gets too dangerous, right? At that point, call your dispatcher. Your dispatcher will ask a security, pretty much talk to the charge nurse or talk to someone to accompany you. Because if it's getting dangerous, especially if the patient is a psychiatric patient or if a patient is under influence of drug or alcohol, patient might act out. At that point, you might need someone to accompany you. Please work together with everyone and have a good positive attitude, and please understand how to talk to patient and taking care of patient that are in pain. Remember, they are inside a hospital because they are in pain, they are sick, they might die. So don't take it too hard what the mean thing they say to you. Remember, you are here as a medical professional. You are here to take care of patient. So understand that dynamic between a sick patient and you as a healthcare provider. So don't take it too hard because some patient might get mean. So understand that. Again, this is a good entry-level job for anyone out there who are interested in the healthcare system and working inside a hospital. I do recommend this job for anyone who want to become a nurse, ER tech, or any kind of tech inside a hospital, a doctor, a PA, or any medical professional inside a hospital. I really do recommend this job because it lets you interact with everyone inside a hospital. You will see different departments and see how a hospital run, especially during divergent, and it does get intense. I'm not gonna lie because it does get intense. As a hospital dispatcher, there are times I had to argue with nurses and charge nurse because everyone, they take care of their own floor, but I'm only one who take care of the transport. So everyone will want to get their way, and it does get intense because everyone will say, I need this, I need to do that. And there's only one department to transport patient. So yeah. Well, I hope you learned something new from this video. What is your thought on the job responsibility and job duties of a transporter inside the hospital? Comment it down below on your thought. And subscribe if you haven't subscribed yet. On this channel, I talk about my life experiences and my journey in healthcare. Okay, I hope you learned something new. Take care of yourself, believe in yourself, stay strong, take care, and love yourself. Bye!